A new health study in the UK says the obesity epidemic in the West could be reversed easily just by reducing serving sizes. The researchers say in homes, supermarkets, and at restaurants, portion sizes are far larger than they were 20 years ago. Burgers, for example, are almost twice the size, and that means the number of calories consumed is much larger too. The average muffin has 300 more calories than it used to, and a regular cup of coffee is more like a meal these days. The CBC's medical contributor, Dr. Danielle Martin, has seen the effects of those bigger savings. Now, there is something kind of obvious about this. You know,
sure, the food gets bigger and we get bigger, right?
Exactly.
It's a portion distortion.
But the calorie totals really are starting to add up quickly.
They add up. So if you think about that muffin we just saw, which 20 years ago was 210 calories and today is 500 calories, you just have a muffin for breakfast for a week, for 7 days, you're going to have to do 6.5 hours more moderate exercise in that week just to break even on the calorie front. And so, those numbers really add up. What we're seeing is a normalization of overeating in our culture, which is particularly concentrated in the areas of breads and pre-packaged foods, snacks, and processed foods. So, that really affects all of us, every bagel eater in the country, but it especially impacts lower income families where those processed, less expensive foods are disproportionately consumed, and that's a real problem.
So if you don't want to do the 6.5 hours.
Right, if you don't want to do this. So as an individual, there's lots we can do, just starting with just knowing what a normal portion size is or should be. We say that portion size of protein is a deck of cards. It should fit in your hand. A portion size of rice or pasta should be about the size of your fist. But actually, at the level of the government, I think that there's much more we can be doing as well, both in terms of making sure that we have easy access to affordable, fresh food, less processed food, and in standardizing the labels across similar foods so that a portion is a portion is a portion when you're trying to figure out those labels at the grocery store.
All right. Danielle, thanks very much.
Thank you.